One of the problems for diabetics and chronically ill patients in Camden and throughout the whole delivery system is that they're out of sight, out of mind. My dog gets more emails from the vet than the average patient is ever contacted by their doctor. All over Camden, all over America right now, there are diabetics lying in their beds with diabetic foot ulcers, sugars in the 500s, and they're depressed and they're falling apart. People end up with diabetic amputations, blindness, heart attacks prematurely, and that's lives wasted and money wasted.
The Camden Coalition program has this Diabetic Collaborative program, which has been excellent and helpful to us from the emergency room. We now have a referral, which we never had before.
We ask the providers to refer to us the people that are lying in the emergency rooms. In 1 year, someone went 113 times, and over 5 years, someone actually went 324 times.
Overutilization of emergency departments is a problem. In the entire country, it's particularly a problem in Camden because there's a lack of access to some of the resources that are needed.
We go out and think about who hasn't been to our office, who hasn't had their labs checked, who are our poorly controlled diabetics, and drive care directly to them. It could be home visits, it can be better patient education.
I just come out of the hospital about 2 weeks ago, and I have nurses come down and see me.
And by coming into their homes, we really learn a lot about them, their life stories that affect their health.
You got to keep your sugar down. If you don't, you're going to be in trouble. So I take my pills and I take my insulin. That's for everybody who wants to keep their diabetes in check.
I think there's a lot of hope that comes out of what the Camden Care Coalition is doing. And it's not only hope for patients in Camden, I think it actually has a lot of comment on our health system in general.
If it were possible for us to capture a portion of the savings that we're generating, and I think we're generating millions and millions of dollars in savings, that just a portion of those savings could fund us forever.
It is cost effective to be healthy. And that's really what the program shows.
136 over 64. That's good.
And the Merck funding has galvanized our partners, it's galvanized the hospitals, the primary care offices, and it's launched us up to a much higher level of collaboration.
A good collaboration has access to programs that can help a person get medicine when they can't afford it, has access to referrals to social service agencies. We know how to help that provider. It's literally an orchestration, a fine orchestration.
And the work of health reform, that's the work of the Merck Foundation and this grant, which is making the delivery system begin to work better for patients.